to hear a few words about fall prevention in the elderly. In today's short talk, we are going to address this very important issue about how we should be dealing with fall prevention as far as the elderly population is concerned. We have seen quite a number of falls that have occurred in the community among the elderly population who have come up with complications to us for treatment. Now, while we are talking about fall prevention in the elderly, I think an appropriate first step will be to define what a fall is. So a fall is an unexpected event, the result of which, the consequence of which is that that person comes to land on the ground or on a lower level. People, when they are older, tend to fall down recurrently. They may fall down once and they may be lucky and get away, but if you don't address the circumstances around that fall, they may have a predisposition to falling down again and again. So any person that has had a fall 2 times or more in the last 12 months is defined as a person having recurrent falls. Now, why are we discussing about these falls? Why are these falls important? Number one is because they are common, in the sense that 1/3 of all older individuals in a year will fall down. Of these 33% that actually fall down, about 10% of falls will lead to a serious injury. The first thing I do is I ask 3 screening questions, and perhaps you should ask yourself these screening questions today. The first question that I ask this older person who comes to me is, have you fallen down in the last 12 months? The second question that you can ask is, if you ask this older person, is, when you are walking, are you fearful of falling down? When they walk, they consciously realize that I'm unsteady or I'm imbalanced, and they are constantly fearful of falls. There are those people who will say that, please, will you help me go from point A to point B? That is already an alarm or a red flag that tells you this patient is imbalanced, okay, and maybe at risk of falling, okay? So those are the 3 questions, right? Have you fallen down in the last 1 year? Are you worried about falling down when you are walking? And thirdly, do you feel imbalanced when you are walking? When a person has a fall, when an older person has a fall, the first thing that we are supposed to do is we are supposed to group these falls into 2. Whether it is a serious fall or whether it is a non-serious fall. So remember that all falls are serious. We should take all falls very seriously. But then there are those falls which will result in serious injury that need expedited action. And then there are those falls that have been that have occurred, but then at least you have some time to work around that patient. If your patient tells you, or if this older gentleman who has fallen down tells you that there has been injury, or tells you that this is my second fall, doctor, okay, this is already an alarm telling you that this is a serious fall. You need to work on it very seriously. If this fall has occurred as a result of frailty, this is an older gentleman that is frailing away, okay, you need to take that very seriously. If this gentleman tells you that I fell down and I could not get up by myself, is another alarm sign that you need to look at, that tells you that this is a fall that you need to look at very seriously, or if they needed assistance for them to get up. Or if this is a fall that was associated with unconsciousness or any other medical symptoms. So let's say someone had maybe a chest pain and then fell down, or maybe someone felt dizzy and fell down, then there may be a medical condition behind that fall that needs to be elaborated. Carpets and rugs in the house which are not fixed and movable. For example, you have floor mats or door mats. These are not movable. These are movable. They are not fixed. So sometimes these older people, as they are walking, they trip over those carpets and those rugs. Or for example, if you have shoes which are loosely fitting, as they are walking, they tend to trip over these loosely fitting shoes. So you have to look at the factors around the house, around the area where the fall occurred. For example, if it is in the stairs, maybe there is no hand railing around the stairs. Commonly, these accidents occur in the bathroom. So the tiles, are they slippery? There is water around there. So all these things, while you have assessed the patient, you must also assess kind of the environment around the patient. Is how do we prevent another fall? Most important is prevention. How do we prevent another fall? And should this fall happen, God forbid, should this fall happen, how do we prevent serious injury? No matter how trivial it is, please make a habit of bringing them to the hospital for a proper evaluation. So in the hospital, again, the doctor will assess head to toe. There will be tests that will be done. Their vitals will be checked. Their blood sugar, their blood pressure, maybe an ECG will be done. Depending on what we find, some blood tests will be done. Maybe there is anemia, the hemoglobin level is low, maybe there is malnutrition. So all these things will need to be addressed in the hospital, and then we will assess how these patients walk. So we will put them we will ask them to stand in the consultation room, they will stand, and we will ask them to walk, and we will see how they walk, and we will find out where the problems are. And then again, in concert with physiotherapy and occupational therapy as a team, we will try to work on these problems. One very important aspect about fall prevention is to eliminate unnecessary medications. And that requires a sit down with the doctor to try and go through the medication list and see what we can avoid, what we can do away with. We try and optimize their cardiac health, make sure that their heart is okay, their blood pressure is okay. Structured exercise is very, very important. As you enable them to exercise, as you enable them to become more ambulant, the walking reflexes come back. Those reflexes which have slowed down, which make you unsteady, they tend to come back. We try and take care of environmental hazards around you. Okay, we try and take care of all those things that are dangerous around you. We try and optimize your nutrition, make sure you have enough food or are taking healthy food, supplementation of vitamin D to make sure that your bones are nice and strong and healthy, so that even in the event that there is a fall, your bones are healthy enough to withstand that fall and not crack or not break. We will check your vision, try and get that corrected. We will check your hearing, we will check your balance. A lot of these things can be corrected to improve the way that you walk. I would say that we want to try and prevent falls from occurring for all our older patients. It really disturbs the family dynamic. It is expensive on the pocket, the tests are expensive, the treatments are expensive. And remember, a fall today is a risk for other complications later, like fractures and even death, for example. Okay? So while this topic may seem trivial, remember that no falls are trivial. All falls are important, they need to be evaluated and they need to be worked up, and wherever possible, prevention is better than cure. Wassalamu alaikum wa rahmatullahi wa barakatuh.